Welcome to another episode of our video series of the critique of modern systems.
It's wonderful to join you. This is certainly heavy material, isn't it? The whole topic of modern obstetrics.
It really is. It requires a sensitive touch, but the systemic problems are just impossible to ignore. How are you feeling about getting into this?
Honestly, I think it's critical. When we look at all this data, a clear picture emerges. We're looking at a fundamental human process, birth, and how it's been handled by our modern systems.
And it seems like it's been handled badly. When we were compiling these sources, the research, the articles, and especially those deeply personal accounts, it was so clear. This pervasive feeling of regret around childbirth, it isn't random.
No, not at all. You could almost call it a design flaw.
A crisis, really, affecting the very beginning of a human life.
That's the critical takeaway right there. You have this mountain of evidence, and it all suggests that when a physiological process is taken over by a clinical high-intervention system, the outcome, even if it's medically safe, is often psychologically devastating.
And the consistency is what's so striking.
It really is. You almost never hear a woman say her birth experience was perfect, or, without a single if-only moment.
Okay, let's unpack this. If we accept that medical safety is, generally high in these settings, what is driving this nearly universal sense of failure, of trauma?
It's a paradox, really. The paradox of modern care. Hospitals, they track their metrics, low mortality, successful surgeries, and they call that good service.
Sure, that makes sense on paper.
But the sources, the personal stories, they reveal that even in these so-called high-performing facilities, at least 80% of women emerge feeling, ruined.
80%, that's an incredible number.
It is. Ruined or deeply dissatisfied or just profoundly unsupported. The system is simply measuring the wrong things.
And the complaints, they aren't about some huge medical catastrophe. They all seem to circle around this one feeling, this deep sense of regret. The sources call them kisses moments.
Exactly. Kisses, if only, that feeling of missing your own agency, of being acted upon rather than participating.
And the themes are just glaring.
Loneliness. That's a huge one. Loneliness, despite being in a brightly lit room, surrounded by people.
And the lack of a real physical companion who is just there for you, guiding you.
That's it. That isolation, it really stands out. You might have a partner there, but if they haven't been educated on the process, they
just become another anxious bystander.
Exactly. So the woman is left completely alone with this primal, non-rational process, and she's just desperate for guidance.
It's the absence of that one voice,
Yeah.
that constant reassuring voice just saying, you're not alone, you can do this.
And that is where the clinical setting fails most profoundly. Birth is instinctual. It needs darkness, quiet, patience, warmth.
But instead, you get the opposite.
You get the operating room. Tiled floors, bright spotlights, staff running through checklists. It creates this psychological distance. It actually inhibits the natural flow of hormones.
It disconnects a woman from her own body's power.
And that makes the whole challenge feel insurmountable, terrifying. The loneliness is a direct byproduct of the clinical architecture.
So if that environment is the problem, it seems like it's being fueled by something deeper, by fear. Which takes us right into the architecture of that fear, and you can see it so clearly in the skyrocketing intervention rates.
The statistics are, they're alarming, especially C-sections. The overall rate in a place like Turkey, where a lot of this analysis comes from, is already high, around 53%.
But in private hospitals, it's a different story.
A completely different story. Those figures jump to 70, sometimes even 95%.
95%.
Yeah.
And even university hospitals are high.
77%. And these are supposed to be the gold standard for nuanced, evidence-based care.
What's fascinating here is how this gets rationalized.
Right.
It's not necessarily malice, is it? It's more like systemic self-preservation.
Precisely. You're seeing the fear engine of modern medicine in action. The sources argue that in legal systems that don't have strong malpractice protections, doctors are basically forced into what's called defensive medicine. The priority just immediately shifts. It's no longer about supporting a healthy physiological process. It's about zero risk for the physician.
And the zero-risk pathway is almost always a C-section, a controlled surgical delivery.
Always. Protecting the doctor from a lawsuit takes precedence over the patient's actual experience.
And to get consent for all these interventions, fear is, it's weaponized.
Absolutely. This is where you see language being used in a really manipulative way, but it's disguised as informed consent.
How so?
Well, think about the actual data. For A healthy, low-risk pregnancy, the rate of severe complications, things leading to infant fatality or permanent injury, is incredibly low. It's about 1.5 in 1,000.
Okay, very, very low.
Right. But the sources show that women are routinely told the risk is as high as 20%.
20%.
Yeah.
That's amplifying the risk by a factor of more than 10.
It's a deliberate strategy. You instill this completely disproportionate fear from the very beginning.
Mm.
The patient is then conditioned to believe that intervention isn't just an option, it's necessary for survival.
So it removes her agency. It basically guarantees compliance for surgery.
And it offloads the doctor's liability. It turns a natural life event into a high-stakes drama before labor has even begun.
That fear narrative,
Yeah.
it has to be challenged by reminding people what birth actually is, a powerful natural process.
Which brings us to the core of it, reclaiming the physiological power of the body. We have to anchor this whole discussion in the body's design, the factory settings, if you will.
Right.
When birth is left alone, the hormonal system manages everything. The speed of contractions, natural pain relief, recovery. It's a finely tuned, self-regulating machine.
Here's where it gets really interesting. The sources use this incredible analogy. Medical over-intervention is like using a bulldozer in a flower garden.
It's the perfect metaphor, isn't it? Birth is an organic, delicate process, a flower garden. And you're introducing this crude, artificial power. Synthetic hormones, surgical tools, constant monitoring.
We're just bulldozing the whole thing.
You are. You're short-circuiting the woman's innate ability to manage her own experience.
And the reward for meeting that challenge on her own terms it's profound. It isn't just about having a baby. It's about self-confidence.
Exactly. The core finding is that when a woman successfully navigates this huge, non-controllable force, it instills a confidence that's
Well, the sources argue it's more foundational than getting an advanced degree.
the knowledge that I did this.
I met the strongest force my body can produce, and I succeeded. That is the ultimate self-efficacy. And that strength is so crucial because strong, resilient mothers raise strong, resilient children.
This leads to a really fundamental challenge from the sources, this sort of counterfactual idea. If we took away all the clinical interventions for low-risk cases, what would the complication rate actually be?
The hypothesis is that it would remain remarkably low, probably not more than 3 to 5%,
Wow.
which dramatically challenges our current culture of mandatory hospital births. That's a recent habit,
Yeah.
only about 100 years old. If the risk is truly that low, the justification for treating every birth like a medical emergency it evaporates. So if the system is designed around fear and control, the solution has to be about education and empathetic support.
A systemic empathetic support. Which takes us to this idea of the unregretted birth. It's a multi-step solution.
And the core principle is really smart.
It's ingenious, really. You keep the safety of the clinical setting, but you infuse it with the atmosphere and the dedicated support you'd get at, say, a home birth.
And step one is the foundation, education. The sources call knowledge the essential antidote to fear.
Because information strips away the power of manipulation. It's that simple. When a woman understands the physiology of birth, why it takes time, what the stages mean, what the real risks are, she can actually engage with medical advice critically.
She can ask questions. She can say no.
It removes that psychological barrier. It empowers her.
Step two is about culture, talking to grandmothers, addressing the whole family unit.
Because we absorb these stories intergenerationally, so many women grew up hearing that birth is just a painful ordeal that only a doctor can save you from.
Right. These negative narratives get passed down.
We have to consciously correct them. Normalize birth as a rite of passage, not just a medical emergency.
And step three is language, getting away from negative words.
Language completely shapes our perception of pain and control. We need to use terms that frame the experience as natural and powerful.
Like using waves instead of contractions or pains.
Exactly. Or dolgular. It changes the whole mental framework. It's not suffering. It's a manageable, undulating force. Even something like a nuchal cord, if you call it a baby with a necklace, it dramatically reduces the alarm around a fairly common thing.
Then step four is logistical, and based on the evidence, it's maybe the most crucial one.
Absolutely. This is a systemic change, not a financial one. You assign every birthing woman a dedicated midwife who stays with her for the entire labor, one-on-one support.
A single trained companion.
And the evidence is overwhelming. Studies show this one change reduces medical interventions by 50%. It drops C-section rates. That constant presence of expert caring support is the psychological safety net she needs.
And finally, step five is the environment itself.
We have to modify the sterile hospital setting. We need to build separate birth centers or birth houses, Handler, right next to hospitals, but architecturally distinct.
Getting away from the green surgical sheets and cold tiles.
Softer lighting, comfortable furnishings. The environment has to support instinct, not inhibit it.
Okay, now let's shift focus to the smallest participant, the unseen patient in all of this, the newborn. The sources suggest the baby has its own if-only moments.
And they register as early trauma. We often ignore the infant's rights, and we do it with the best intentions.
There's that analogy.
Yes. If you were taking care of a cat giving birth, you'd give it quiet, darkness, and you'd leave it alone.
But with a human newborn.
It's blinding spotlights, loud voices, and immediate separation from the only environment and human it has ever known.
So while the labor can feel uncontrollable, the moments right after the birth, those are completely controllable. And they are so vital for the baby.
Yes, that's where the power lies. The key requests for parents are simple but critical. 1, delayed cord clamping. 2, low lighting. And 3, immediate sustained skin-to-skin contact. No removal to a separate room unless it is absolutely medically necessary.
And what's the long-term cost of ignoring this, of that initial shock and separation?
It registers as trauma. The very first message the infant receives is, "The world is hostile and mom is gone."
And that can manifest decades later.
As profound attachment issues, difficulty regulating stress, a pervasive anxiety, yes.
The sources even mention some preliminary studies suggesting a behavioral link.
It's fascinating. There's early research connecting certain interventions like induction with synthetic hormones or vacuum extraction to adult coping strategies.
What do you mean?
The idea is that a baby who is sort of pushed into the world by an external force might, as an adult, show a greater dependence on external support to start new things, rather than relying on their own internal drive.
That's incredible. It really underscores how the birth experience can shape a whole life.
The entire trajectory of human development, the mental architecture.
So what does this all mean? We've traced this problem from systemic fear to psychological isolation. Birth has been systematically abnormalized.
It's moved from a normal life event to a feared medical procedure, governed by what the sources call the empire of fear, the Corcu Imperator Lulu.
We have a system designed for institutional protection, not human flourishing.
But the hopeful part is that this is a failure of design, and design flaws can be fixed. Change is driven by collective, informed demand.
So I would really encourage you, the listener, especially if you're planning a family, to see birth education as essential armor. It's protection against fear and unnecessary intervention.
Demand those changes.
Demand the cultural shifts, the infrastructural changes, demand birth houses, the softer dosum handler, instead of just accepting the sterile, old hospital birth halls.
And let me leave you with this final thought. This fight for an unregretted birth, it isn't just about maternal happiness. It is fundamentally a fight for protective, preventive public health. Because the physical safety and the psychological resilience of the next generation are largely determined by how they arrive in the world. If we solve the birth crisis, we prevent countless crises down the line. That's how foundational this really is.